Hello ladies, we're here at bod Cosmetic Center with Dr.Osak.
Hey guys, how are you?
Hi doctor, how are you?
Fantastic.
How was your weekend?
Very, very nice, relaxing. It was actually kind of a cold and rainy day in Miami.
I know, it was cold and it was hot, but it's a nice weather. I don't know if you could see, I already put my boots, I put my sweater.
This is winter clothes in Miami.
Yes, I know, and you can see everybody now outside. I don't know if the camera guy could see outside the office, everybody's wearing boots and stuff like that.
Yeah.
But doctor, we're here because you're pretty booked out already.
Yeah, it's tax season again.
I
know. The first couple months of the year are always super, super busy.
I remember last year working with you that we were working until like 12 o'clock at night.
Yeah,
we were completely booked.
Yeah.
Patients were getting mad because we didn't have enough space for them.
It's like that every year. Every springtime in Miami, it's just packed.
So it's true what they say, that income tax it makes everybody more beautiful. It fits everybody. People get that little money to make their little waves.
I think they're getting ready for the summer. People prepare for the spring so they can have their summer beach body.
Yes.
We
all have to get prepared. I have to get prepared too.
I have to get prepared too.
You owe me a breast consultation, remember?
Yeah, anytime. I'm happy. But you're beautiful. I don't think you need anything.
Thank you, doctor. But ladies, the doctor's gonna do my breast because it's been like 13 years that I did a breast augmentation, silicone implants. So it's been a while. So I wanted to.
I think it's if you're having any issues with your breast, I think after 10 years you should have them checked out with silicone implants and get an MRI scan every couple of years. It's a good way to see what's going on. If you're over 40, I don't think you're 20.
No.
You're 22?
20. I'm 22.
22, yeah, 22. So you got a couple years before you need to get a mammogram or anything.
No, doctor. But it's been what? My son is 13 years old. It's been 13 years that I did the breast augmentation silicone. So it's time to change it because gravity goes down, so they're not up like they used to be before. Not getting any younger. But I'm getting better, thanks to
you're getting better every day.
Thank you, doctor. So, and my sister is having surgery with you as well.
Yes, she is. Yeah.
She's having a mommy makeover.
Yeah, another beautiful young lady. But she had 2 kids, right?
She has 2 kids.
Yeah, she has 2 kids. So after 2 children, it's common to have what they call like a mommy makeover, which is any type of breast surgery, like a breast lift or breast implants, and maybe even a tummy tuck with some liposuction to contour her midsection.
And my daughter, Dr.Osak, my daughter Nico, I'm sure she's watching us right now. She's at Seduction, sitting down there in Worcester.
Very beautiful young lady.
Oh, thank you, doctor.
Right? She looked out great. Yeah.
Yes, she looks fantastic. She was completely flat.
Yeah, she had a very athletic. She must have played sports or something.
Yeah, she did tracks. Yes.
Yeah, she was a track star, and so she had a very athletic frame. But now, I think we put not too big, maybe 350.
I think it was 350. Yeah, silicone implants.
Silicone implants. She's absolutely gorgeous, beautiful young lady.
Doctor, so now that the income tax is coming, Valentine's is coming too.
Yes, it is, ladies. Valentine's is right around the corner.
So a lot of patients want the breast augmentation, the cleavage, the booty as well.
Yeah, that's what we do here at bod. We, body contouring is our specialty, and this is really, we're gearing up. All the staff is working extra hard with consultations to, get everybody on a schedule for the next couple months. So.
Ladies, I know you guys know, everybody that's watching, that Dr.Osak had a rough year, but he's still working, he's still a doctor. He does more than 20,000 surgeries over the year.
No, goodness gracious, 20,000, no, it's about 3,000 a year.
3,000 a year?
Yeah, not 20,000.
I thought you did like 20,000 because you were so much booked out.
Yeah, 20,000.
It looked to me like you were doing more than 20,000.
Yeah,
but you did a lot of surgery.
Yeah. I've been in practice since 2007, so it's been 10 years. 10 years this year that I've been in practice, and in the life of your career, you're gonna have ups and downs, but no matter what, you got to stay positive and keep making people beautiful.
We all have upside down, doctors. Even people in their regular life, you get married, they get divorced, they have a boyfriend, they broke up, they have kids, people passed away,
for sure.
Family problems, money problems, everyone has problems.
I think what's most important is your attitude and your outlook. If you stay positive and keep working on your goals and your vision, all the ups and downs of life get actually pretty smooth.
We were looking at your real self a minute ago, and you have
hundreds
of like great
fantastic reviews.
reviews if you guys wanted more reviews, if you want to see more about Dr. Osak and read more, you should see those reviews in the real self, because they're honest. They're patients that had their surgery done with you that are very happy.
I think patients are the greatest resource that we have, you know, and my work speaks for itself, basically. So
yes, you done beautiful.
Yeah, so I'm happy. Yeah, Real Self is a great resource for a lot of patients. You know, they leave very honest reviews. It's not filtered in any way. So it's a great resource for people to leave their good reviews. And you'll see there are hundreds of fantastic reviews about me.
Yeah,
you know?
I mean, everybody's going to have a bad day. Everybody's going to have a bad review. Even you go to a restaurant that is 5-star and you see the bad reviews, the good reviews, everything.
I mean, it's a numbers game. And my goal is to treat everybody like they're a family, like my sister or my mom. And the reviews speak to that test, you know? I mean, if you do thousands of cases, you know, 1 or 2 you're going to have a complication, but that comes with the territory, that comes with the career. You can't be a plastic surgeon and operate and not have 1 or 2 complications. So.
Yeah. Doctor, what about we're getting a lot of patients that they do need a tummy tuck, but they still want to do the BBL.
That's a pretty common dilemma, you know. I mean, the BBL is such a popular operation nowadays, but I like to think of the body as in its totality, not just focus, say, on one body part. Because when you see somebody, it's a complete image, you know. So having a flat tummy and a small waist, I always thought that was a prerequisite for having a nice shape. And so girls that need tummy tuck, they should get tummy tucks. Now the question is, what should you do first? You know?
Yes, I'm going to cut you there, doctor.
Yeah.
I feel patients are afraid that if they come because they want to do BBL and there's doctors or you suggested to do a tummy tuck, that they're not going to have enough fat for later on to do the BBL.
That's not true. Whatever fat you have is what you have. So the women that need tummy tucks usually have a lot of loose skin. So you really have to consider what body part or what tissue needs to be addressed. If you have loose skin, if you have a lot of fat, if your muscles are very loose, and you have to address each anatomical structure as it needs to be. So for instance, the tummy tuck is very good in tightening the muscle to make it look like you're sucking your stomach in all the way. And if you have any loose hanging skin at the bottom, the tummy tuck can address that. Okay? But if you have a lot of fat, then liposuction can address that. Liposuction with a possible fat transfer to your butt can address that. So it really depends on what the main cause of your shape is. Now, if the main issue is loose skin and loose muscle, then a tummy tuck would address that.
What about, doctor, breast augmentation when they do need a lift and they just don't want to do a lift, they just want to do an implant? I know the implant stays up and the breast still stagnant. So what do you recommend?
Some people call that the Snoopy deformity, because they'll have still very droopy, ptotic breasts, but implants that stay high. I think it's a matter, it's a common question, you know, want versus need, you know, and you may want something and you need something, you may need something, you may want something, and those two have to meet.
I think we'll have that. You may need something, but you want something, or you want something and you need something.
It's true for plastic surgery, for cars, for life, for homes, for
I need a lot of things, but I want this. I think,
So it's the same thing, you know, and so if you, if you want a breast augmentation, you're a good candidate for it, get it. If you need a breast lift and you're a good candidate for it, get it. I think that's where experience of the doctor comes in, judgment, a little psychology comes into it as well. And but my goal is to, what do you say? You want to make Miami even more beautiful than it is now.
Miami more beautiful.
Right. So it's a conversation between the patient and the doctor to make sure that they get what they want and what I can provide for them. So it's really.
It's funny because you said even making Miami more beautiful than what it is right now. Right now, I think Miami has the most beautiful ladies in the world, because you walk everywhere you walk, you have the small waist, the big
go to South Beach for a half hour.
No, anywhere. You go here around Coral Gables and you see the little waist, the big booty, the nice breasts, beautiful faces, beautiful hair. Miami's beautiful everywhere you go.
That's why people come from all over the country.
It's hard for guys to walk in Miami nowadays, so ladies,
hold on to your
neck. Doctor, I know a lot of patients, they don't say the truth when they want to do a surgery because they're afraid that they get canceled. I want them to understand the importance of saying the truth. It's like, we're not here to judge them. We're not the cops. We're not gonna do anything against that. We just want to let them know that if they taking drugs or doing anything that is against the surgery, they're gonna die on the table. What can you say about that?
Yeah, I mean, just in life, honesty is the best policy, you know, and that's even more true when you're having an operation, when you're having surgery, and you know, your life is in my hands. So it's important for you to be honest about any medical problems, if you're taking any drugs that we need to know about, not just drugs like cocaine or something, but even medications, you know. I mean, there's certain drug interactions that we need to be aware of, that anesthesia needs to be aware of. So I'm pretty good at eliciting honesty from patients, and but one of my fears is that patients aren't honest. You know, there was a girl at another place, you know, that was doing cocaine, and she had surgery, and that didn't work out too well. So always be honest with your doctor. There's patient-doctor confidentiality. There are HIPAA laws that prevent me from saying anything about patients. So honesty, always number one. I need all the information so I can make a good choice as to what operation is best for you.
I always tell patients before they travel, because we have like most of 80% of the patients are from New York, from Boston,
from
New Jersey, from all over the country.
Yeah.
So I always tell them 2 weeks before the surgery, go to the PCP, go to the primary doctor, and get a medical clearance.
Smoking is a big issue. So if you smoke cigarettes or even vaping, you know, I know people like to vape now instead of cigarettes.
Yeah.
You know, but nicotine is the culprit. Okay, so
I have a lot of patients that said, yeah, I smoked the vapor, but it doesn't have nicotine. Like I have a friend that's having surgery with soon. I can say her name, but she doesn't smoke regular cigarettes. She does the vapor, but she's saying that the vapor doesn't have any nicotine.
The liquid, the juice that you put in it, you can vary the amount of nicotine. So I think people have tried to quit smoking by vaping by reducing the amount of nicotine in the liquid that they put into the machine. And you know, if you don't have it, there's a urine test you can take to see whether or not if you have been exposed to nicotine. And if it's high, then usually that's a cause for me to cancel an operation, because nicotine can lead to skin problems, healing problems, infection, necrosis, all the nightmares, all the nightmare plastic surgery stories that you've seen pictures of can be caused by nicotine. So you got to be honest. If you smoke cigarettes, then maybe this is a good opportunity for you to quit.
So basically, the best thing, ladies, 2 weeks before surgery, try to go to your medical doctor, your PCP, get a medical clearance, get a CBC, get a urinalysis done.
Yeah.
4 weeks before surgery, stop smoking, no alcohol, no drugs, no birth control, no fentanyl.
Yeah, fentanyl.
Diet medication is very important.
Very good. Yeah.
Try to be clean before your surgery, at least 4 weeks before surgery. That will be much better for you. And remember, this is a surgery that they're choosing. This is not something mandatory.
It's elective.
So you could always move it. You could always do it next month or in a week.
Right. It's elective surgery. It's by choice. So that's why there's very little tolerance for complications.
Doctor, what about, we have a lot of patients that travel.
Yep.
They come, they never had high blood pressure before. And then they come and the blood pressure is super high.
There's something called white coat syndrome, where where patients are a bit nervous or afraid of doctors that come in with a white lab coat. That's why a lot of plastic surgeons don't even wear the lab coat. They come in dressed in suits that are very casual, not casual, but professional, but not wearing a white coat, because that can cause a certain amount of anxiety. But that can be, if you recheck the blood pressure, it's normal. But what happens a lot is that you have middle-aged women who haven't been diagnosed with high blood pressure, who come in and with the lab and our evaluation discover that they have high blood pressure. And that happened a couple weeks ago, I think.
Yeah, we had a patient that she's never had high blood pressure before, and every day when she went back to the hotel, the blood pressure was perfectly fine. She came here and it was super high.
Yeah, so I think what we did in that case, we had her go back to her primary care doctor, who confirmed that she actually had high blood pressure, and then she got put on medications. So that's a good opportunity for her. Like, we discovered that she had high blood pressure. She didn't get her operation, and I think she got rescheduled.
Yeah, she got rescheduled.
But that's that she's lucky. Now she knows she had high blood pressure. She's taking medication, then diet modification to treat what she didn't know she had prior to coming to the office. So
that's why, again, I said before you travel, ladies, go to your doctor, go to your PCP doctor, get a medical clearance, just go do some lab work like a CBC.
Yeah, I think that plastic surgery is a fantastic career choice and field, but health is always trumps. Health, health always.
No politics here,
no
doctor.
politics. It's a politic-free zone, but like health is
you
more
were thinking
important.
in Trump, doctor?
No, I mean health
I'm
is
not
more
gonna ask you
important.
who you vote for, but
Health is more important than looks.
yes. Yes,
So
it is.
it's a new year.
It's a new year. We have to have peace. We have to move forward. We have to accept whoever is the president and make sure and pray that everything's going to be great and he's going to have a lot of jobs and a lot of good benefits for everybody, and we're going to have an amazing year. 4 years with him.
Yeah, amazing 4 years and amazing tax season and amazing springtime in beautiful Miami.
Yes.
So.
Doctor.
Yeah.
So how is Dr. Osak? What is Dr. Osak does in his life?
In my free time.
Because I know you have a daughter.
I have a daughter. I have a beautiful 10-year-old daughter. Her name is Brooke, and I love her with all my heart. And what do I do? What's your question? What do I do in my free time?
Yeah, what do you do in your free time?
I think that really my main focus is staying healthy. Trying to exercise as much as I can, which is a challenge. I know. Listen.
You little chubby doctor.
I made a New Year's resolution. I'm back in the gym. I gained a few pounds over Christmas and Thanksgiving, so I'm back out. I'm running. I love running. I did a marathon actually a couple years back.
Really? That's good. A couple of years back.
A couple years back, a couple pounds back. So I try to exercise as much as I can, like reading, traveling. I traveled a lot last year. Saw some, beautiful places, beautiful world. Get out there and see it. And that's basically it. Try to stay healthy, travel as much as I can, take vacations when I can, when I'm not, doing BBLs and operating, and being happy.
What's your favorite surgery, doctor? What's the favorite part of the body that you like to do?
So it depends. What's my favorite? There's things that I'm very, very good at, that I do all the time. And like BBLs and breast surgery, breast augmentation, breast lift. I think I can't pick one. I can't pick one favorite operation.
Because I know, by working with you all this many years, that your favorite surgeries are BBL, lipo, breast augmentation, breast lift, and tummy tucks, mommy makeover.
That's.
You don't like to do faces. You don't like to do anything, and you do amazing arm lift, body lift.
Yeah, right. I think actually that's a good point. I think my favorite operations and patients, I love them. I love all my patients, obviously, but massive weight loss patients that have had gastric bypasses or gastric sleeve and lost 150 pounds.
I don't know if you remember this patient, the male patient that we had 2 years ago.
Yeah, the guy.
He's a correctional officer.
Right.
Lost a lot of pounds, like up 250 pounds.
Mm-hmm.
Changed.
Yeah, I think those patients have been so grateful, and they've come such a long way from where they were when they weighed 400, 500 pounds. So the transition and the before and after is so amazing that it's always gratifying to treat those patients that lost a lot of weight. Obviously, I like the young and healthy, simple hour-long breast augmentation. Those are fun too. But the patient that lost like 150 pounds, and you see the really dramatic before and after, it's always very gratifying.
For me, I feel so much happier when I see a patient that sometimes I'm walking in the store, in Publix, when they see, and they come to me, Dayomie, thank you, look how I look.
Yeah,
they're happy, they hug you, they kiss you. When they send you beautiful messages, patients, we love when you guys send us beautiful messages.
Absolutely.
Even when you're mad, we're here to help you. But when they write us like, oh my God, look at how I look now, thank you, you changed my life. Words of affirmation,
absolutely.
they're very important because it makes you feel much better, and that way you do much better for them because you want to do more for those kind of patients.
And I'm blessed to have this field where people have, there's such a dramatic change, it's what other profession can you, like, in one day totally change how you look? You can't, you can't do that in
I love what I do. I've been doing this since I was 17, working in cosmetic surgery, and it's such an
immediate gratification of
Yes.
coming in one day and then a week later you've completely changed someone's life for the better, and they're happy, they feel more confident, sexier. You know, it's a good feeling right here. So that's why I do it.
Yes, it is a good feeling. And you have patients all over the world. So if you go to any out of state city, you're gonna have patients everywhere. You never know.
Yeah, it's funny. It's weird sometimes you're walking in, because I mean, I'm have a normal life. You know, I still go to the gym and go grocery shopping and, you know, go to a bar, and you'll still see a patient. You know,
Yes.
you'll see a patient out there in the community.
Yeah.
And it's, oh my God, doctor, oh my God.
Yeah, I went to, in Halloween, I went with my boyfriend and my kids. We went to Halloween Horror Night, and we had patients
you know, that's
slapping
funny.
me.
No, I went to
I had patients slapping in my butt. Dayomie, this is Dayomie,
Oh, the
I love
Disney.
it.
Yeah, that's
I was
right.
like, oh
That's
my
right.
God.
Last year I was at Island of Adventure in Orlando, and I saw two of my patients up in the. It was fun, you know, very nice.
It was nice.
You know?
It's nice when you know you see people that you haven't seen for a while. They're your patients and they're happy. You know,
Right.
that means you treat them well. You treat them with respect, with love, and like you said, you treat them like family. Like they're your sisters, your mom, your daughters.
I think family and community is important. I mean, this office is basically one big family.
Yes,
You
it
know,
is.
and we treat our patients like family. So I think that's what keeps patients coming back and keeps the referrals and all that coming in, how you treat people.
My rule is you need to treat people how you want them to treat you. Even if they treat you bad, you have to treat them well. Because then when someone is treating you bad and you're treating that person nice and well, they're going to react. And they're going to say, hold on, she's treating me so nice and I'm treating them so bad.
That's the golden rule, right?
Yes.
Yeah, that's what
The
we all
golden
do.
rule. So always treat everybody with respect, like they're your family, like they're your kids, like they're your mom. That's my rule number one. And remember, we Joint Commission accredited as well.
Yeah, so this place is a wonderful facility. Everything's accredited. I mean, it's basically, like you said, functions like a hospital.
Yes.
You know, we have all the toys and all the gadgets and all the
we have
equipment and everything that we need. It's a wonderful.
And our
place to
number
be.
one priority, lady, is safe.
Safety number one.
We want to make sure everybody has good health.
Yeah.
That everything is on protocol.
Yeah.
The labs are in order. I know we do a lot of tests. We do a lot of lab work on patients. We do EKG, we do X-ray, mammograms, ultrasound, medical claims, but it's good for the patients to have all these things.
And once that's all done, once we have safety under control, then it's beauty.
Yes.
Right? Safety number one, then beauty number
Beauty
two.
comes number second.
Exactly.
There's a patient that told me the other day, what's your number one priority? I said, my number one priority is me. Me.
She said it.
No, your number one priority should be safety, of course, for us that we're in the cosmetic center. For your personal, it should be you, because when you're happy, everything else comes more happier.
Yeah, I think that's a good way to live.
Yeah, and then if you give yourself the priority of being happy, you're gonna treat everybody else with respect and with happiness.
And we make people happier, you know? Patients
every day.
they're smiling, grinning from ear to ear, you know?
So ladies, Dr.Osak was completely booked, but we still have a chance to get you on schedule. Call us here at bod Cosmetic Center, send us your message, send us your picture, your which picture. The doctor's here 7 days a week.
No.
We could do Monday to Saturday.
6 days a week.
6 days a week.
I
Sunday. He could do FaceTime. He's here. He could call you. You could speak to him personally. He's very nice about that. He's always available to answer all your questions. All you have to do is send us your picture, send us your inquiry about what surgery you want to have done with Dr.Osak, and you can speak to this amazing doctor here at bod Cosmetic Surgery and book your next surgery.
All right. Very
Doctor,
good.
do you know that phone number here by any chance?
We have a wonderful website, and
I'm gonna get you the phone number.
You want?
I'm gonna get you the phone number. It's right here. So I want you to learn this number, doctor.
Do you want me to memorize the office number?
So it's 305.
Do we have staff for that?
305-392-1027. What's the number, doctor?
305-392-1027.
So once again, ladies, 305-392-1027. Call us here at bod Cosmetic Surgery and book your next surgery with this amazing doctor, Dr.Osak. So we'll see you soon.
Thank you. Have a great day. Thank you, Dayomie.
Thank you,
Very
doctor.
nice, huh?
Yeah.
Good.